In this video, I'll tell you about the causes of stroke, symptoms and prevention tips for stroke, and how we can lower the risk of stroke by natural ways. Hi everyone, welcome to my channel. Health Tips with Miss Beautiful. First, let's talk about stroke. Stroke is a serious medical condition that affects millions of people around the world. Stroke occurs when the blood supply to the brain is interrupted, causing brain cells to die. Stroke can cause permanent disability or death, so it's vital to recognize the signs and seek immediate medical help. Let's know about types of stroke and risk factors. There are two main types of stroke: ischemic and hemorrhagic. Ischemic stroke is the most common type, accounting for about 85% of all strokes. It happens when a blood clot blocks or narrows an artery that carries blood to the brain. The clot can form in the brain itself or in another part of the body and travel to the brain. This reduces the blood flow and oxygen to the brain tissue, causing it to die. Some of the risk factors for ischemic stroke are high blood pressure, high cholesterol, diabetes, smoking, and heart disease. Hemorrhagic stroke is less common, but more deadly. It occurs when a blood vessel in the brain ruptures or leaks, causing bleeding in the brain. The blood puts pressure on the brain cells and damages them. Hemorrhagic stroke can be caused by aneurysms, which are weak spots in the blood vessel walls, or by arteriovenous malformations, which are abnormal connections between arteries and veins. Some of the risk factors for hemorrhagic stroke are high blood pressure, alcohol abuse, blood thinners, and head trauma. Now let's know about symptoms of stroke. The symptoms of stroke depend on the part of the brain that is affected and the extent of the damage. However, some common symptoms are sudden weakness or numbness in the face, arm, or leg, especially on one side of the body, sudden confusion or trouble speaking or understanding, sudden vision problems in one or both eyes, sudden severe headache with no known cause, and sudden trouble walking, balancing, or coordinating. If you or someone you know is experiencing any of these symptoms, you need to call on your local emergency number right away. Don't wait to see if the symptoms go away. Every minute counts. The sooner the person gets treatment, the better the chances of recovery. Now let's talk about how to prevent stroke by natural ways. The best way to prevent stroke is to avoid the risk factors that can cause it. Here are some tips that can help you lower your risk of stroke or prevent it from happening again. Number 1. Healthy diet. Eat a healthy diet that is low in salt, sugar, and saturated fat. This can help you maintain a healthy weight, lower your blood pressure and cholesterol, and prevent diabetes. Number 2. Physical activity. Exercise regularly, at least 150 minutes of moderate intensity physical activity per week. This can help you improve your cardiovascular health, lower your blood pressure and cholesterol, and prevent diabetes. Number 3. Quit smoking. Quit smoking, or don't start if you haven't. Smoking damages your blood vessels, increases your blood pressure, and makes your blood more likely to clot. It also reduces the amount of oxygen that reaches your brain. Number 4. Limit alcohol. Limit your alcohol intake, or avoid it altogether. Alcohol can raise your blood pressure, increase your risk of bleeding, and interfere with your medication. If you do drink, limit yourself to no more than 1 drink per day for women and 2 drinks per day for men. Number 5. Control stress. Manage your stress levels or find healthy ways to cope with it. Stress can raise your blood pressure, affect your mood, and make you more likely to engage in unhealthy behaviors. Try to relax, meditate, listen to music, or do something that makes you happy. Number 6. Regularly checking vitals. The most important is to control your blood pressure, cholesterol, and diabetes, or get them checked regularly. These are the major risk factors for stroke, and they can be controlled with medication, diet, and exercise. Follow your doctor's advice and take your medication as prescribed. Number 7. Medication or surgery. Take medication or undergo surgery if recommended by your doctor. Depending on your condition and your risk of stroke, your doctor may prescribe you some medication to prevent blood clots, lower your blood pressure or cholesterol, or treat your heart disease. Your doctor may also suggest some surgical procedures, such as carotid endarterectomy, angioplasty, stent placement, or coil embolization, to remove or repair the blockage or bleeding in your blood vessels. That's all for today's video. I hope you learned something new about stroke, its causes, symptoms, and prevention tips. Thank you for watching. If you liked this video, please give it a thumbs up, share it with your friends and family, and leave a comment below. And don't forget to subscribe to my channel for more videos like this. See you next time.